governor's orders. Again, no citations, no arrest. Businesses have continued to be very cooperative as they were approached by law enforcement officials and advised of what the requirements are. With regard to questions that we received, and I'll kind of go through these questions. I'll mention in several places that the healthcare provider representatives that are here may certainly have something to add, and some of these I will defer directly to them because I think it is more than mine. First question, are there any new testing sites in the county on top of what was reported? I'm going to, again, let the healthcare providers identify the test sites that they have associated with their various facilities across the county. My sense is from the Bell County perspective that we do have adequate testing sites across the county, and the numbers seem to reflect that also, I think, in terms of the number of tests that have been run over the past week or 2 weeks or so. In addition to that, I want to make sure, I think this was pushed already to the media and to the public, but there are 2 mobile test collection sites that will occur on May 8th, which is tomorrow or soon, May 8th. And they are at the Troy Fire Department, 201 East Main Street in Troy, and at the Rogers Fire Department, 6 West Avenue in Rogers. Those testing sites will be active from 8 a.m. to 5 p.m. Again, on May 8th. You will be screened. So again, these test sites are for folks who are demonstrating symptoms, so you must be symptomatic, and there will be a health assessment or screening done at the site. The screening will see if you have, and this is listed on the flyers and the information that went out, fever and or chills, cough, either dry or productive, fatigue, body aches, muscle or joint pain, shortness of breath, sore throat, headaches, nausea, vomiting, diarrhea, nasal congestion, loss of taste and or smell. To register for these tests, you can do this in 2 ways. You can visit a web address, txcovidtest.org, txcovidtest.org, or call 512-883-2400, 512-883-2400. So those are additional test sites that, again, will be available on May 8th, and those are coming to us or to Bell County through the Texas Department of Emergency Management, through the governor's office. They have sent teams out across the state to do additional testing. Second question, has there been an increase in testing over the last week or 2? And again, I'll let Dr. Chadwell address those numbers, but I think if you look on your dashboard, and I didn't print off last week's numbers associated with that, but as of yesterday anyway, the cumulative tests that have been run were 8,720. And so that's from my perspective, that's a significant number of tests. And again, I think if you compare that to the number that was the week before, that shows a fairly significant increase in terms of testing. But again, I'll let Dr. Chadwell address that in more detail. Coryell Memorial, next question. Coryell Memorial in Coryell County, Gatesville, has offered to test hairstylists and others who restart their work on Friday. Do we have anything like that? As most of you know, as we've said before from this podium, most of the testing, the vast majority of testing, is done by the private sector and not the public health sector. And so I'm going to let, again, our healthcare providers address what testing they're doing, the criteria for that testing, the locations for those testings. But again, I would say that we have a significant amount of testing going on already in the county. Now that said, in terms of testing for a particular employer or a particular business, I think an employer can choose to do that at any moment in time. Again, the private labs being available, an employer can reach out to those private labs and initiate those tests and run those if they so desire to do so. The other thing I would highlight is a test is only a snapshot in time. And I think that probably needs to be recognized by an employer or anyone else who's doing those testing, is that it's good certainly for the day that it's done, not necessarily afterwards in terms of identifying or for safety factors going forward necessarily. All that said, to answer your question, I'm not aware of anything that any of the local healthcare providers are doing on the same basis that I have heard or read about Coryell Memorial doing in Gatesville. Does the county's testing system allow for people tested who do not have symptoms? Are you requiring the screening before the testing? I think I've already sort of answered that, at least with those mobile test collection sites that I mentioned a moment ago. But it's my understanding, again, I will let the healthcare providers address each one of their testing sites or their facilities. But it's my understanding you do still need to be symptomatic, and there's always a health screen in front of the testing. But again, I'll let them address that. When do you think you might offer more widespread testing? Again, I think I've already addressed that, at least from my chair. I believe we already have widespread testing available across the county, and I'll let our healthcare providers address that if they want to elaborate on that or feel differently. Do you think there will be a second wave of coronavirus spread in the fall, and how do you monitor that possibility? And I'll defer that question to Dr. Chadwell. What are you doing to prepare? I'm assuming this question is part B of the question that I just read in terms of if there is a second wave coming, how would we monitor that, and then what would we be doing to prepare? I can answer that from the Bell County standpoint in terms of Bell County emergency management and preparedness. And I would say we're doing three things right now in anticipation of whatever the next event is. I think we've mentioned again several times that while new viruses, novel viruses, are nothing new in the sense that we have seen those occur in the past, and I anticipate we'll see them again in the future. What is very different and very new has been our response to this virus. And so if this response is indeed the response that we can anticipate being recommended by healthcare professionals for the next new virus, whether it's a recurrence of COVID-19 or whether it's something else, then what we're doing on our end from a Bell County emergency management standpoint is two or three things. One of them is we're really assessing our protective equipment stockpile, looking at masks, gowns, gloves, hand sanitizer, all of those kinds of things, and just making sure that we have what we hope is an adequate supply of those for our first responder use, for internal use also in terms of county services. We are also what I would call hardening our facilities to the degree that we can. As I speak right now, we're working on what we can do for the July 14th elections in terms of making that election process that is scheduled to occur on July 14th as safe as possible, and also trying to maintain some of the, as many of the health protocols we can in terms of social distancing, in terms of barriers between individuals where we can make that both physical as well as just separate. But we're going through that whole process, not just for that election, but also for county facilities across the county, again, in anticipation that this is the new normal with regard to the response to the next virus. And then finally, I would say we're reviewing internally our own health standard protocols in terms of what we need to be doing and how we need to be conducting business inside the county and for the residents that we serve. And so we want to make sure to the degree that we can, with the knowledge that we have today, how we can continue to provide services to the Bell County residents and keep our offices open and operating. That's what we're doing, at least from the county standpoint. Again, I'll let the healthcare representatives identify what they may be doing to prepare for the fall or the next virus. This question, I think, was directed to me. Will you be involved with school districts when they open? I have a two-part answer for that. The first part of the answer is it depends on the governor and what authority he allows local jurisdictions across the state to exercise. With the most recent round of executive orders, that authority has been centralized in his office, so there's been very little authority, at least that I believe that the county judge has relative to not just school districts, but local regulations and orders, period. So that said, I will say that I have had continuous conversations through this entire event with almost all of our area school superintendents. It's been a very collaborative and a very cooperative discussion. I appreciate the conversations that we had, and I continue to stand ready to assist them any way I can. And again, those conversations have been very productive, I think, at least from my standpoint. The school districts have been very, very engaged in that. The next question also involves school districts. Will the county be making any recommendations on when schools will reopen? My formal or official answer on that is it depends on the governor and what authority, again, he allows to be exercised at the local level. But as of right now, that decision and that ultimately rests with the state of Texas and through the governor's office. Does the county have any recommendations to schools on when they should open? And you probably already can anticipate my answer on this one, but as of today, and things can and will change, I think, between now and the decision point for when schools have to make that decision about opening and how they're going to open in the fall. What I would recommend they do is to continue to do what they have been doing, which is working on multiple opening plans. And I think they have been doing that since for the past several weeks, both for the end of this semester, school year semesters and for the summer. But I think they're also going to be doing that for the fall in terms of just trying to make sure they're prepared for whatever the governor's office indicates is the plan for opening the schools in the fall. How has the partial reopening of the state impacted Bell County both economically and in terms of cases of the virus? And anticipating what my answer is on that, the follow-up on that is it's too early. If it's too early to assess the economic impact of Bell County, do I have an estimate on that impact? And so the first part of that question is, how has this impacted Bell County economically? What I would say, it is too early to make a really complete or accurate assessment of the economic impacts of COVID-19 on Bell County. I think that said, I think we're in good shape from a budget standpoint as we approach the last fiscal quarter of this fiscal year. The real challenge, I think, is in front of us, and that's to assess and plan for the next fiscal year. We don't have enough historical data at this point to really accurately forecast the impacts of this COVID-19 event on things like our sales tax revenue or property valuations, which impact property tax revenue. And those are the two primary sources of revenue for the county to provide the services that we do across the county. You combine the COVID-19 event, the price of a barrel of oil, and the importance of oil and gas revenue to the state of Texas economy, and the impact on our overall economy in Texas. My assessment right now is simply there's a whole lot of uncertainty as a result of both the COVID-19 event and the oil and gas industry and the impacts that the price of oil is having on that right now. So again, I think there's a lot of uncertainty out there, which means for the remainder of this fiscal year and going into the next fiscal year, I think that demands that we exercise a lot of caution as we go into our budgeting process going forward. Next question was, do you feel the curve is flattening at a rate that suggests progress is being made in Bell County? And then a couple of comments looking at the graph, and I'm assuming this is the graph from the dashboard, from the Public Health District dashboard. Looking at the graph showing cases over time, the number has steadily climbed every day. What do you attribute that to? What does flattening of the curve look like? Is it no cases for several days? Again, I'm going to let Dr. Chadwell address those questions, but I want to make a comment on at least what I feel flattening of the curve rate suggests when I look at the dashboard for the Bell County Public Health District. And one of the key areas that I look at on that dashboard is the Bell County cases by date tested positive. And that's kind of on the bottom half of the dashboard, center left. When you look at that dashboard, that graph, what I see is from April 20th to May 6th, which is 16 days, there were cases reported on April 20th. There were 3 reported on May 6th. And then look across those entire 16 days. And when you look across those entire 16 days, that to me looks like a flattening of the curve. Now, and I think Dr. Chadwell will elaborate on this, but I think the next week or 10 days is pretty important to watch that same graph and to see what the number of positive cases looks like on a day-to-day basis over the next week or 2. And the reason for that is the governor has opened up more and more businesses with restrictions, but nonetheless, more and more businesses are open. The shelter-in-place order has been lifted by the governor. So there's a lot of people out now and moving around. So it'll be interesting to see if those case numbers continue to be along the same level that they have been for the past 16 days. But again, I'll let Dr. Chadwell address that in more detail. Next question, is there a larger concern in Killeen, given that it is almost double the cases of any other city, or do you attribute that to the larger population? And I'll let Dr. Chadwell address that. Next question was, are there any cases in the Bell County Jail or in nursing homes? Again, I'll let Dr. Chadwell address that. I will tell you that there are no cases been reported in the Bell County Jail. Is the active case number the difference between the number confirmed and recovered? And I'll let Dr. Chadwell address that one also. And then I think the last question that I got prior to this was, and again, most of this is commentary, but I'll go ahead and read it as a question. Congressman Carter recently put out a press release this morning, this was on Monday, saying that Bell and Williamson County health providers will be getting $76 million in CARES Act money. Wanted to see if I knew how much money in Bell County, how much money we would be getting, and how this will benefit county and local providers. And as the press release indicated, that $76 million, well, 2 things. $76 million for Bell and Williamson County health providers. So that's the first comment. Make sure you understand that it's 2 counties, not just Bell County. And then my second comment on that is I don't know how much of that money is coming to Bell County healthcare providers, nor can I tell you exactly what the Bell County health providers will do with the funds that they receive. And they may have some information about the allocation that is coming to their respective healthcare facilities. I don't know that, but again, I'll let them either answer that question or advise you that they don't know what those dollars are. To date, I haven't seen any allocations for those funds, at least come across my desk. Okay, with that, that's all the questions that I received prior to the press conference. So with that, I'm going to turn it over to Dr. Chadwell with the Bell County Public Health District and let her make comments and run over the.
Good morning. So I don't have, again, numbers for the states and the Fed at this point in time. They haven't updated those yet, but I can tell you preliminarily we're sitting at about 199 with the county. And again, staff may update that as they're going through and confirming cases, and they may add some more, they may subtract. It depends on what they find as they're doing the case investigation initially. So I'll go ahead and address some of the questions that have been brought up, and a couple of them are ones that Judge Blackburn alluded to just a moment ago, but I'll expand on some of that. And one of the questions is with regard to a comment I made at the last press conference about sample sizes. So I've been asked about more complex analysis for our sample of COVID-19 population, of the COVID-19 patients in our population. And what I can tell you is that, again, it's a very small sample size, and I'm not going to bore you with the statistical mumbo jumbo, but what I can say is that yes, we can do some things with that data. We can assess trends, we can assess person, place, and time, which are some of the most important things epidemiologically speaking, and we can determine policy recommendations on the basis of that data. Whether or not we need to take additional steps to prevent the spread is informed by that data. Now, if you want to start doing things like assessing disparity, like we talked about previously, you need a significant amount more information to do that. As I'd said, the race and ethnicity data is a voluntary measure. It's not complete in all of our records because not everyone wants to share that, but we would need 400 complete data points to actually do anything valuable with that as terms of assessing disparity with any amount of significant confidence statistically. So we're obviously not there yet. The next question, do you feel the curve is flattening at a rate that suggests progress is being made in Bell County? It looks to be. Now, the reference to two different charts on the dashboard. One is to the right of the dashboard, and that's the one referenced in this question, talking about a steady climb every day. So that chart's a build up. It's going to start with whatever our first number of cases reported, and it's going to build every day. So anytime we add cases, it's going to add to that bar. Now, having said that, if we don't add cases, it'll flatten out, but it's never going to drop, if that makes sense. And that does show you that curve. If you look toward the top of that bar, you will see that it's starting to slope off. And that does indicate that we are engaging in a flattening. But of course, we have been adding cases pretty consistently with the exception of 1 or 2 days. The chart that Judge Blackburn referred to previously underneath the map to the left, that cases by date reported, that's really where you want to look to see more indicators of that flattening and monitor that to see if we see any major spikes. And if we do, we'll be making recommendations, and we're keeping a close eye on that. And let's see here. Is there a larger concern in Killeen given that the population is almost double? No, that's matches what we'd expect for population. Our population in Killeen is the largest, obviously, and if you look at our data, you can see that the number of individuals in each population represents closely where that rank falls in our population. So Killeen has the most, Temple is second. It's sensible, it makes sense to us. And as far as the jail, that has already been addressed, but there have been some cases in nursing homes, and I want to take an opportunity right now to actually commend our partners, because anytime we have seen nursing home cases in those congregate settings, they have been on point with supporting us, and any of the staff at those facilities have done so as well. They have been with us 100% and have been helping us contain any of that. We have not seen any outbreaks in any of those facilities. We've seen isolated cases. As a matter of fact, since it started, we've seen fewer than 10, and that's including employees and residents at any facility that's been impacted. And is the number of cases the difference between the number of confirmed and recovered? Yes. Yes, that's accurate. So if you want to see the accurate number of cases, you can do that subtraction and calculate that. And I think that's all that I had. Oh, I apologize, one more thing. Judge Blackburn had asked me to assess how many tests had been conducted since about the 30th of April. And in doing the math on that, we were going to add another almost 300 tests that were reported to me today. We haven't updated that on the dashboard yet, but it's about 3,000 tests have been reported to me. And that's a combination of our hospitals reporting to us as well as the DSHS testing report. So just about 3,000 tests have been conducted in that time period. And I think that's all I have for you. All right, go ahead and answer questions if you have any at the moment.
So with this increase in testing that we've seen...
News 10 starts now with a breaking news alert.
I'm sorry about that. I don't know where that wasn't me. I don't know where it came from. But so we've seen, you know, you said 3,000 since I think it's the 30th, but going back to the first time we heard...
That is strange.
The first time we got numbers on testing, it was 3,000. Now we're up to, you know, 8,000. That's 6,000 new tests. I'm just curious what we're learning. You know, testing has more than doubled in the last few weeks. What have we learned from that increase in testing?
What that's told me actually is that we do seem to be definitely engaging in a flattening of the curve, because when you see increased testing, you do expect to see more positives result from that, and we haven't really seen many more positives resulting from that testing. Now, it's ramped up pretty significantly recently, so we are expecting that we might see some additional cases, so we might see a spike of, say, 15 in a day. That wouldn't be terribly alarming given the extreme increase in testing, but the fact that we've seen such an increase in this short period of time and really haven't seen a lot more positives is encouraging. Any other questions?
Yeah, what does it mean plateauing? I think some people might have a perception that means no more new cases and it's just a flat line. Kind of explain that for the layman.
Sure. So it doesn't necessarily mean that we aren't seeing any new cases. It means that the number of new cases is not dramatically increasing over time. So we're not climbing that hill, at least not at a dramatic rate. It's staying relatively level. We might report a few new cases, but it's not dramatically more than we reported the day before. We're not significantly adding more cases. We're going to expect, I mean, this is a new virus, it's in our population, it's not as if when this is over, it's going to have gone away. We will see a smattering of COVID-19 cases reported, probably for the rest of our lives. I mean, it's going to be something that we see in our population, but so far it's not looking like something that's going to necessarily be as dramatic as it's been. Now that it's moving through the population, we're hoping that it seems to level out and that it's going to be manageable going forward. But again, we're keeping an eye on it to make sure that's the case. Anything else?
Can you talk about when we might see results from the state opening up here locally? It had first been mentioned that, you know, we'll do phase 1 and then wait 2 weeks and see what happens and then do phase 2. But we're already jumping to open more stuff up now. Can you just explain that process of how long it takes and when we expect to see numbers from opening up?
So when someone is exposed to COVID-19, you expect them to start developing symptoms, and it's different for every person for a variety of reasons, but anywhere from a week to 14 days from that exposure, you would expect to see symptoms develop if they're going to become symptomatic. So given that, I'd target probably the 13th or the 14th. If we're going to see a spike, that's probably when we'd see it. Anything else? Okay, thank you.
Thank you, Dr. Chadwell. At this time, I'd like to call on Ms. Karen Purcell, who is the Executive Director for Quality at Advent Healthcare Systems in Central Texas. Ms. Purcell.
Good morning. At Advent Health Central Texas, right now, we're continuing to see COVID patients, both inpatient and outpatient. We are offering the evidence-based medical treatment that you can expect at all of our sister hospitals. That includes the most appropriate and up-to-date drug therapies. We're also able to support convalescent plasma transfusion and some of the more advanced therapies that have been recommended in literature. We have assumed a COVID-ready stance at this point. Knowing that this virus will not go away, we're assuming that our healthcare environment looks different and will continue to look different. To facilitate that, we are offering safety as our priority and our staff safety as our priority as well. So our daily attention is focused on PPE availability, how we ensure that we're ready for whether there's a spike or whether there's continued just maintenance, that we have the adequate supply and facilities for that. We also continue to monitor equipment availability, including ventilators and oxygen support devices for our community and our patients that would come to our facility. And we are shaping our care and services to ensure safety, which looks like 100% of Advent Health employees are being tested for COVID, so that we know in that snapshot of time who has had COVID or who is infected with COVID, and we can monitor that correctly. And we look forward to continuing some form of a monitoring of COVID status of our patients ongoing. We're also doing 100% screening of all visitors, patients, and staff who enter the building. So everyone receives a temperature screening, as well as asking the questions of if they've been exposed or if they have any symptomology that would make us concerned for COVID. We have 100% masking within the facility at all times. So every person who enters, whether that be a patient, a visitor, a vendor, a family member, everyone is asked to wear a mask so that we can maintain appropriate social distancing for safety. And then we're continuing to monitor all the services that we provide against the evidence that is out there, because every day we have growing information about how to best treat, prevent, and accommodate our new healthcare environment with COVID as a factor. We are providing varying types of COVID screening or testing to patients depending on the kind of treatment or intervention they're receiving at our facility. So some patients will receive simply the screening, others will receive scheduled COVID testing before their procedure so that we can ensure we're offering them the most safe care. We are currently scheduling and performing surgical procedures, cath lab procedures, interventional radiology, sleep lab, and other pulmonary appointments. MRI, CT, ultrasound, and women's radiology are functioning at this time. And then we're still continuing to reopen other services, including pulmonary rehabilitation, laboratory, and x-ray services, which will be coming online shortly. As we're doing this, the focus will be on ensuring that our new processes create safety. So our facility will look a little bit different to our patients who are coming there, meaning that we have mobilized virtual check-in, that we have folks waiting in their appointments so that we don't have gatherings in our waiting rooms. And then we are using many more virtual services when able. So sometimes your primary care doctor appointment will be virtual versus being in person, depending on what the complaint is and how we need to help you. Aligned with CMS and the federal Opening America guidelines, we are still restricting visitors so that we can assume less people and less chance of exposure for that. So that will be expected to be ongoing for a bit longer. We are offering drive-through testing for our community members, so that is in front of the hospital. And that is if you've been exposed or if you have symptomology that makes you concerned that you have COVID, we will test you for COVID. It is a sputum test, so it's a bit more convenient than some of the first tests that were rolled out. And that is billed to your insurance, but no out-of-pocket pay. We anticipate that as CARES funding is released, dependent on the federal directives of how we're able to spend that money, if given the choice, our priority will be to focus on PPE purchase and ensuring that we continue to have that maintenance of supply so that we're ready for you to see us as a patient. Finally, this week, amid the challenges of COVID, we have the privilege of celebrating our nurses. This is the year of the nurse, and it's Nurses Week. So we're honoring our facility and our community nurses for their very specific role that they've played in the COVID-19, and knowing that their sacrifices have been significant, and we appreciate them, and they're a rock to our healthcare. So any of our nurses in the community, we want to wish you a happy Nurses Week. Are there any questions that I can answer? Okay, thank you.
Thank you, Mr. Purcell. I'd like to call on Dr. Greenberg, who is the Director for Emergency Services, Baylor Scott and White Temple.
Morning, Bobby Greenberg, emergency physician at Baylor Scott and White in Temple. Appreciate the opportunity to talk with everybody. First up, I'd like to say I really agree with what Judge Blackburn has said, and then what Dr. Chadwell has said about the care that's being provided in the county, the approach the county has taken, and kind of what's going on with this current pandemic. As far as the question regarding testing sites, I still think the focus should be on access to care and access to testing, not specifically just testing sites. I think you've heard that all of the testing that is done requires screening. So that is your first access to the system. For Baylor Scott and White, that access is best done through our website or through our app. And that will direct you as to whether or not you need to be tested or not. As far as the operations at Scott and White in Temple and McLean Children's in Temple, we are back open. We're slowly ramping up all services. We are doing procedures, we're doing surgery. And just like the other facilities and under the guidance of the CDC, we also have what we call our Safe Care program, which includes screening visitors, screening patients prior to having procedures and surgery, just to make sure that the patient will be safe and that our caregivers will be safe. So just like every place in the United States right now, when you come to see us for business, you will see that we're doing business differently than we all did back in February. And I believe that's all I have as a report, because I think the report from the county was pretty comprehensive, and I'll be happy to answer any questions that you might have. Well, Judge, I think you did a good job. You left them speechless.
All right, I wanted to add one more thing and then open it up for questions before we close up here, and then you can direct those to me or to anyone else, and we'll get them back up here. And I want to make sure I understood Dr. Chadwell's numbers a moment ago. But if I understood correctly, we've done about 3,000 more tests since last Thursday. Does that sound right? 30th. Okay. So a week ago today, we've done additional 3,000 tests. That's about, by my math, that's about 428 tests a day that have occurred over 7 days. Again, getting our cumulative total to 8,720. And again, I think what you heard from the healthcare, from Dr. Chadwell and healthcare providers is we appear to have adequate testing going on across the county, at least from my perspective. There are multiple facilities where you can go to get tested. And so I think, again, from my perspective, I'm very pleased with the work that the healthcare providers have done, the work that the health district and also. All right, with that, I'll open it up to any questions that you might have, if you would. Helps me if you'd identify yourself and the agency that you're with as you ask a question. So any questions that we have not addressed or that you want us to elaborate on?
Hey, Judge, it's Jacob from the Telegram. Do you have any concerns about the governor and consequences for violating his executive orders? Without teeth, who follows the orders?
And Jacob, I'm sorry, I didn't get the first part of the question. Did I have any concerns about?
The governor eliminating consequences for violating his executive orders.
Yeah,
That
I think that's a question.
Today, I think.
Yeah, I would say that's a question more for the governor than for me. But from our standpoint, I say our standpoint, from the county standpoint, his orders have the full force and effect of law. And that includes from the first order all the way to the one that he issued a couple of days ago. So from that standpoint, county officials and local law enforcement officials are going to continue to enforce those orders as they are state law. Any other questions?
Hi, this is Megan with KWTX. We have a viewer asking on Facebook about the testing numbers. They're wondering if we are, or if you guys are seeing people take multiple tests, and if that's accounted for in the total. Is the total just straight up out the number of tests that have been done, or is there any, I guess, are you tracking if a person is taking the test multiple times?
Yeah, I'm going to look over to my healthcare provider. Dr. Chadwell is going to come forward and she can address that question.
So we talked about that when we started talking about reporting from our healthcare providers, and that question was asked of me. They're actually using patient identifiers. So if someone does take the test multiple times, and I know that some of the employees, for example, maybe tested multiple times, they are not double counting those. Now, I can't speak for the private labs that are reporting to DSHS. I'm reporting the numbers that DSHS is putting out, but I can't say whether there's any double counting in those numbers. I hope that helps.
Any other questions?
Megan with KWTX again. This question is for you, Judge. What are your thoughts? I had asked Dr. Chadwell about this, and she said that it'll probably be May 14th when we see results from the state opening back up. We've already moved on to phase 2. I'm just curious your thoughts on that, since we haven't even seen the results from phase 1 yet, and we've jumped to phase 2. What are your thoughts?
My thoughts are just simply, I agree with Dr. Chadwell's comments in the sense that I think over the next week to 10 days or so, we'll see what the impact is in terms of the reopening measures that the governor has authorized. My hope is that our residents, as well as our businesses that are reopening, will continue to follow the healthcare protocols that have been set for social distancing, masking when you cannot maintain social distancing in hot, densely populated areas, wash hands, high-risk individuals, I think the governor has urged in every single press conference, stressed that folks over 65, folks with underlying health conditions, need to continue to be extremely vigilant in all of those social distancing protocols, and in fact continue to stay home if they can, to the extent that they can. So my hope is that all of those measures that have been ingrained into us over the past few weeks, that I continue to practice those. And I think if they do, then I think we'll continue to see good numbers in terms of how this event is hopefully being managed, and how we can return to, again, some semblance of normal, both in our everyday lives and for our businesses also. Any other questions?
I have one more follow-up for you if nobody else has anything. I'm wondering what the process would be if, so say we get to the 14th of May, and I guess this goes back to something I asked you a few weeks ago, that when it came to shutting down the state, local government had the authority to make a decision on their own, but you had said at this time, as far as opening up, it's statewide and we're required to follow the governor's orders. I'm curious what the process would be when we get to May 14th. If we see a problem here in Bell County, a huge spike in cases, what that channel is like for you to communicate with the governor's office and with the state with any concerns that you might have for our community locally.
Yes. There has been, the governor's office has been very good with his press conferences. Of course, as all of you know, I think he's been doing them at least on a weekly basis, and sometimes more than that. But there's also been reach outs by his office to elected officials across the state, conference calls that I've been involved in where himself is on the line, as well as some of the officials that are advising him, Dr. Hellerstadt, Chief Kidd, Rath, I mean, a variety of folks that he has made available to county judges and mayors on a one-on-one basis almost across the state. Those conversations and those calls have been very helpful. He's also provided us with contact information for individuals in his office, as well as contact with other state agencies that, again, continue to be very responsive to questions or issues or concerns that we have. So I say all that to say that I believe that process would continue, so that if and when it occurs that we do have some issues that are specific to Bell County, that there are avenues there for me to reach down to Austin and make those known. The governor and his office has been responsive to date on those. Any other questions? I'll close this then. I appreciate all of my healthcare provider representatives who are here. Thank you for being here. Thank you for your comments and for your updates. I want to stress again what I said just a moment ago, in the sense that I do think it's extremely important, and especially over the next week or two, for all of us in Bell County to continue to practice the health protocols authorities have been recommending since day one in this event. As businesses reopen, as all of us begin to resume some normalcy, practicing those social protocols, distancing protocols, will help us maintain this course. So I would urge you to continue to do that. Thank you.
Thank you. The meeting has now ended.